play a short programme, a video from Professor David Haslam.
Oh.
That's all right, I'm not going to do it. Professor David Haslam, who's the director of the National Beeson Forum, and he's talking about weight management in pharmacies.
Professor David Haslam, I'm chair of the National Beeson Forum. I'm a GP in rural Hertfordshire, and I'm a physician of Eastern medicine at the Legion Hospital. When patients become overweight or obese, then eating normal food has gone badly wrong. They've eaten too much of it, maybe they've done too little exercise, maybe other factors such as genetic factors or environmental factors, but just eating normal food, something's gone wrong. And so by starting a diet such as a very low calorie diet, it's reversing the problem that eating too much normal food has done. And it's important to bear in mind that a modern very low calorie diet is nutritionally complete. It has got all the minerals and vitamins, everything that's necessary. So it's nutritionally complete. Nothing is being lacked by a very low calorie diet apart from the volume of food. NICE requires that results be evidence-based, but given that lipotrim can't be tested against a placebo, how can enough evidence be accumulated for the medical community to take such observations seriously? VLCDs can't possibly be tested against placebo for obvious reasons, but there's plenty of evidence that tests VLCDs against standard care. So as a clinician, I'm interested in how well my patient does who goes off on a very low calorie diet compared to my other patients that are just under my standard care who don't go on very low calorie diets. And there's plenty of evidence that suggests that VLCDs are successful not only in losing weight but in maintaining weight loss. Now, one thing that is important is that NICE back VLCDs. NICE deem them to be appropriate, but only in certain circumstances, which is that they have to be monitored by a healthcare clinician, which in the case of lipotrim, for instance, can be a GP or it can be a pharmacist, and that's, the monitoring there is very effective. It's in many cases now that's on computers as a monitoring of the week-by-week visit, which can be well audited. So there's plenty of evidence there, and the monitoring there is in place, and so I'm satisfied that this is an appropriate method for my patients. It's been said by surgeons that other than bariatric surgery, there are no other treatments that put diabetes in remission. But lipotrim claims to produce results that are comparable. What would you say is its impact on type 2 diabetes? There are various methods of weight loss that are used, ranging from walking the dog, going to the gym, to calorie counting. And each one, there's a whole spectrum of the amount of weight that a person can lose. Each one induces a different degree of weight loss. So if someone has just been diagnosed as having type 2 diabetes and has just crossed that threshold of sugar levels, of glucose levels, then actually any weight loss regime can put diabetes into remission. But there are areas such as a very low calorie diet, bariatric surgery, in which a person loses significantly more weight. It's a much more emphatic degree of weight loss. And so these methods can put someone with type 2 diabetes in remission, even if they've had diabetes for a long time, even if they're on insulin and multiple different oral medications. These are the two methods to use. It's quite right. It can put type 2 diabetes into remission, and that can last a long time. With weight regain, diabetes can always come back. But initially, these are the two methods, very low calorie diet, bariatric surgery, that regularly put diabetes into remission. Can lipotrim be used by a diabetic? Lipotrim and other very low calorie diets can certainly be used by type 2 diabetic patients. And it's important to remember that 90% of patients with type 2 diabetes have their diabetes because of the excess weight that they carry. And so it's perfectly logical to use regimes such as lipotrim in order to reduce the weight. And we know from the evidence that with that weight reduction, that blood sugars can be normalised. So patients can go into remission of diabetes, which means their sugars are normal without any anti-diabetes medication. So certainly lipotrim on a very low calorie diet are ideal for type 2 diabetic patients and with excess weight. Is remission of diabetes the only medical benefit that is achievable with weight loss? Remission of diabetes is only one of many improvements that will occur in a person's health with weight loss. Because weight loss leads to a lot of different problems. It leads to diabetes, cardiovascular disease, liver disease, sleep apnea, infertility, all sorts of problems. There isn't a single organ or system in the body that isn't adversely affected by overweight Initial weight loss with lipotriene releases considerable amounts of water that was bound to glycogen, the initial fuel. The diuresis may lower blood pressure in hypertensive patients. Weight loss is likely to lower it further. If the patient is on blood pressure medication, are there medical implications?
There are medical implications of weight loss and blood pressure. In the long term, there's a reduction in blood pressure, which is of course highly beneficial in reducing risk of heart disease and stroke. But in the short term, at the very early stages of a diet, such as a very low calorie diet, then there is an initial diuresis when quite a high volume of fluid is lost in the body. And so blood pressure does need monitoring carefully by a clinician just to make sure it doesn't drop too low. In the long term, it's highly beneficial to drop blood pressure and hopefully reduce medications in the long term. With significant weight loss, many medications can be reduced, and this has been shown in a lot of studies that prescribing costs after weight loss do reduce dramatically. But it varies with different conditions. For instance, in patients with type 2 diabetes, there needs to be an immediate reduction, if not a cessation, of anti-diabetes medication. With high blood pressure, it tends to be a more slow reduction in blood pressure, and so blood pressure medications can be knocked off at different periods of time after weight loss. Weight management can be carried out in many different arenas. It can be in my surgery as a GP, it can be in my nurse's clinic, or it can be in a pharmacy. Pharmacy are doing more and more with weight management as part of their public health campaigns and their new contract. I think they're ideally placed to manage weight because they access a lot of our patients who get their repeat prescriptions, so those with chronic diseases who need to be seen regularly. Also, they see people who would never come to see me, they've never set foot inside my surgery. So pharmacists, in many ways, are ideal healthcare clinicians who can be involved in weight management, and I very much encourage that.
Right, I'll just move up onto here.
Yeah. Just click on the right. Click on the right box.
Oh, that was going to...
Yeah, that's it. And F5.
Here we go. Now, obviously, downstairs I told you I was going to be Beeson. I am the clinical program director for the lipotriene program. Now, the program was set up for general practice. We used to do postgrad training days for GPs, so it ran in general practice exclusively for over 13 years. And after doing some think tanks with GPs, it was extended into pharmacy, and it's actually been running in pharmacy for over 12 years now. And there are over 2,000 pharmacies that run the program. So some of the paperwork and the slides are a little bit outdated about the numbers. Now I'm going to talk about helping people to lose weight to prevent long-term health problems. Now this morning we've just seen from that research that the top 4 things for independence that patients are coming in to see you for is diabetes, blood pressure, constipation, IBS problems, and stopping smoking. And stopping smoking is an interesting one because a lot of people fail at stopping smoking or choose not to do it because they worry about weight gain. So weight has an impact on everything you see in health problems. So remember that, link it all together. The main priority is for type 2 diabetes, which is primarily due to overweight. And there was a recent article in the GP magazine reported a 7-fold increase in insulin use for type 2 diabetics over a 9-year period. Massive increased costs to the health service for insulin rose from 156 million to 359 million. Most of that insulin is unnecessary if we're doing something in pharmacy and public health to do something about weight problems. 60% of the UK population are overweight, 30% are obese. If we estimate 60 million people, that calculates to 36 million overweight people and 18 million people are obese. So it's unreasonable to assume there will only be one solution. So weight management is about offering various services in the pharmacy, not just one particular thing. More than half of all the people who come into your pharmacy need advice about weight management and the comorbidities. Again, diabetes, high blood pressure. So every day your pharmacy, half the customers coming in need your advice for this type of service. Weight management is a key area to get involved with. Key points about weight management services. Now, a lot of the information I'm giving you today is from the pharmacies that we train and offer the service, so they're giving us their main tips. Obviously promote the weight management service alongside other pharmacy services. Get in touch with local GPs and tell them that you're offering a weight management service. Lots of pharmacies don't do that. And I know in lots of areas we've got miserable groups of GPs that think pharmacists are alien beings and don't want to speak to them. And I come across that when I go training. There's some very unfriendly areas where they don't want to work together. But you need to approach your local surgeries and say you're offering weight management. Get as much training as possible from various sources. Fully understand the problem and how it relates to ill health. It's worth the effort. Everything you do in pharmacy that's related to ill health is linked to weight problems. Tips for successful weight management. Most importantly is interested staff. Now, you know, everybody's team can't always offer all the services. Ask the staff who's interested in doing weight management, especially if they've got a weight problem themselves. We offer some free stock to pharmacies when they start the programme. Use that for the staff to use. Half the pharmacists are overweight, half your staff are overweight. So they're interested in losing some weight themselves. That will encourage them to have some empathy and some understanding for the programme if they get a personal benefit to it. So think about that as well when you're choosing staff. Again, have suitable equipment. Lots of pharmacies have scales, but they might be a cheap pair from Argos. They're not good enough. Lots of pharmacies have upgraded and have decent scales, but they need to accommodate higher weights. We're not just seeing people with a stone or two to lose. A great number of pharmacies are seeing patients in the high 20 stone bracket, and we provide scales for our service that weigh up to 32 stone. So the worst scenario is trying to weigh a patient and your scale clicks onto H for heavy or does something worse. So be aware of that. Also looking in consultation rooms. Some rooms, you know, people aren't fortunate to have great big consultation rooms, but they need to be tidy and uncluttered. A big person might not be steady on their feet, and when they come into the consultation room, they don't want to see a very small chair with arms on it, which is going to be impossible for them to sit on. So if you offer a weight management service, you need at least one chair that has no arms, that someone can come in and feel confident that that's the chair they're going to sit down on. Obvious things, but not always thought about. Know your customers by name, and lots of independents, this is your strength. You do know the people local to you. You do know their name, and make a point of remembering that. And again about names, get staff to wear badges. So if one of your staff members is going to be doing the weight management service, put Linda, weight management or something on there. So when she's in the store and doing anything, people can think, well, that's the lady, I can just approach her and ask her about weight. Makes it easy to get that customer conversation going. You do need empathy. Now, you need to understand the weight problem and need to listen to the customer as well and be supportive. Non-judgmental. It takes phenomenal courage for people with weight problems to come into a pharmacy and ask for help. They don't go to GP surgeries. It's so intimidating to have a GP appointment, it doesn't happen. They far rather come to pharmacy. And as I've trained the GPs and trained all the pharmacists over the years, I know that to be true. And we've done lots of patient focus groups. They'd rather come in a pharmacy than go into a GP practice. Be professional and respectful. Now that sounds very obvious, but it's not always the case. Younger members of staff might, be sniggering in the corner when someone very big lumbers into the pharmacy, has a problem coming in, and it's easy to point the fingers at, for goodness sake, how are you going to let yourself get like that? Customers overhear these things, are very conscious of this type of thing going on. So make sure everybody is very professional and respectful. It is a medical problem, and you need to understand that for your customers. Being positive and enthusiastic when they come in for weekly weigh-ins. They're looking forward to coming into the pharmacy and seeing how much weight they've lost. It is a social thing, as Finn said this morning. For lots of people who don't travel long distances, their local community is where they get everything from. The pharmacy, the local shops, they're not travelling long distance necessarily. So it is their social thing to come in, and a nice word from the pharmacy and the staff makes all the difference. Encouragement when they're losing weight. Lots of people have a lot of weight to lose. They're going to be coming in over several months. So it's difficult if people struggle. They need some encouragement to keep going. And we always say, look back achieved. Well done, Mrs. James, you've already lost 3 stone. Think where you started from, what your BMI was. Don't think, oh, well, you've only got 2 more months to go, or 6 weeks till the end. Don't focus on that. Focus on the achievement already. Again, remind patients of their start BMI. Have BMI charts readily available in the pharmacy. As a weight management company, we provide BMI charts. We do A4s, A3s, big posters. Have one in the window. It's easy for customers to read. We have instructions that tell them how to read it, so they don't have to put the finger in anybody else knows what their weight or their BMI is. Reminds people, as weight goes up, medical risk goes up. So as weight comes down, medical risk comes down. So simple things like any weight loss you achieve has a medical benefit. So simple things from a BMI chart. Use visual aids, the BMI chart, weight loss graphs, the fat model. If you looked at my table downstairs, that's a plastic model of 5 pounds of human fat. It's anatomically correct. And it looks quite unpleasant, but that's just 5 pounds of weight. We're having patients losing 2, 3, 4 stone. You can buy a pound model, pound weight model. It's not very expensive. You can buy them online. It's something to have to make a conversation. If it's in the consultation room and someone's coming into you for an MUR or blood pressure check, what's that? Well, that's actually a pound of fat. You pick it up, it weighs a pound. Oh, my goodness, look how much it weighs. Oh, I need to lose at least 10 of those. Well, we have a weight management service. Sally's the girl you need to talk to. If you want to take one of our leaflets, you've made a customer for weight management. All these little props for any of your services need to be in your consultation rooms. It was quite frightening from that research presented this morning that 50% of customers don't know there's a consultation room and what it's used for. So the more times you take a customer in there to tell them anything, even if they're asking you about something and want to show you a spot or their son or anything they're doing, take them in the consultation room so they're aware that it exists. Even if you're going to discuss something about which laxatives they want to use. Not everybody wants that discussed openly on the shop floor. And again, if they come in with a child, Finn's saying big users of families with children under 11. If they come in and say, Johnny's got this funny little rash on his hands, go in the consultation room with Johnny. So mother is aware that consultation room is there and there's a private element in the pharmacy. So that's a big key thing that everybody's missing, not using that consultation room. Medical milestones when people are losing weight. Blood pressure reduction. Again, if you're doing medicine use reviews, we often say that's an ideal time to talk about weight and other issues related to your customers' medications. So if they have got high blood pressure and it's only borderline, it's often weight related. So you can bring that into the conversation and we could actually probably get you blood pressure medication reduced or even off it if you thought about losing some weight, and just tie it in together during the medicine use review, and it links into your other services. Remission of diabetes. One of the biggest problems we face now is the growth in diabetic type 2 diabetes. And practically all type 2 diabetes is weight related. So again, in the Asian populations, you're very aware of this. Much, much lower BMIs when people have got diabetes problems. You don't have to be obese. So the overweight, really, diabetes kicks in from about BMI 22. So it's don't wait till people are overweight and in the obese categories. It's early on, it's prevention. And if you're key in an area, if you've got a very Asian population close to you, you want to support your area, you need to understand it's a bigger issue in your population and be aware that you can do something about it in the pharmacy.
Just to interrupt, that BMI of 22 related to diabetes, is that across populations or
It actually is across population. I mean, it's it's even lower. I mean, it's quite specific for Asians. I mean, we have got some BMI breakdowns of in blacks, whites, Asians, where it breaks down. But generally, there was a massive nurse study done a long time ago, and even you can see, and I think in the statistics for that, it was hovering around BMI 22. So it's not just for the Asian population.
BMI 24 in the South Asian population
is
equivalent to the white population at BMI 30.
Really?
Yeah.
So your overweight patients who are borderline or overweight are a massive market for you. And the problem is, because half the population are overweight, we're used to what overweight looks like. So you see, I'm overweight, but you think, oh, we all look reasonably normal, we all pat our tummies. But if you actually do your BMI, you've got several stone to lose. But because we all are slightly overweight, that's more the norm. Thinner people are now the minority, so we think they're odd. We're the normal because the mass population are overweight. And we see that, and when people come into the pharmacy, you mustn't fall into the trap and say, we don't look like you need to lose any weight. You must take people in the consultation room, do a height and a weight, and show them on the BMI chart. Those BMI charts truly represent risk to ill health.
I think there is just a lady last week only. She is on early stage, and her BMI was 30. And within 2 months, she lost quite a bit of weight, sort of thing. But the BMI hasn't dropped down. So he's asking me, oh, why the BMI hasn't gone down? I didn't have an answer for that, sort of thing.
Well, if she's lost weight, it would have gone down because your BMI is your weight divided by your height squared. So it had to have come down. So either someone made a mistake in the calculation and were not understanding it. So you must understand BMI. So if you don't, you need to understand it and how to calculate it. And actually on our website, we have a BMI calculator and anybody can link into it. And imperial or metric, because lots of people just don't understand metric, and that's all over their head. Customers want to know what they weigh in stones and pounds. So again, for your scales, conversion charts, we provide all of that as part of the service. Because, Mrs. Jones, who's 62, doesn't know about kilos. So she wants to know if she's 10 stone or 8 stone. But you were going to ask a question?
It's useful information about diabetes, especially in Asian people. Otherwise, vitamin D actually prevents the development of diabetes.
Yeah.
There is a study in Finland which involved looking at children, more than European countries, but not problem with diabetes.
Yeah.
And this study involved giving newborn children 1,000 units of vitamin D on a daily basis throughout the first year of life. Then the kids were followed for 31 years. They were able to prevent the development of type 1 diabetes by almost 80%.
What about type 1?
Yeah, we're talking about type.
Type 1.
Yeah, type 1.
Type 1.
But that's interesting.
But also, diabetes slows down the progression of diabetic symptoms if you've got type 2 diabetes. There is an issue. Obviously, I think research needs to be done into this, especially when you're looking at the Asian population. The biggest problem you've got in this country, not a lot of sunshine. It takes a great exposure in terms of time for you to generate vitamin D in your skin if you've got darker pigment, if your skin is darker than it is if you're fairer.
That's right. It's not enough sun to
time frames
stimulate.
are like between, for somebody with fair skin complexion, it's about 30 minutes. Where you simply expose your forearms, and somebody who's got darker skin complexion, Asian, it's about an hour. If you get Afro-Caribbean skin, very dark, then you're looking at close to hour and a half, 2.5 hours. It's something which is being totally ignored. You guys might be interested, but there's a guy called Dr. Michael Hollick. He's an American doctor. He's been looking at vitamin D for 30 years. If you go online and have a look, you might find it interesting.
Yeah. Bring that up in the group session downstairs if you want to, so more people can hear it.
The thing is that
I do need to carry on, or else I won't keep on time. Sorry. Now, long-term care available is on the high street. You're there all the time offering these services. So you're going to offer free future weigh-ins for people. They're free. You don't need to charge. You have customer loyalty if they can come in and be weighed in your pharmacy. Recently, in the GP magazine, the average cost of drugs for a normal BMI 20 patient is about £8 a year. The average cost of drugs for an obese BMI patient is £64 a year. Now, obviously, prescription delivery is a good service, but it means you're reducing footfall in pharmacy. You need to attract footfall into pharmacy, and you need to do that by offering services. Now, the people who need the most use of services are the overweight and the obese. They're the bigger users of prescription, so they're going to need MURs, they're going to need all the services, blood pressure, cholesterol, weight management. They are your key customers. And as that research showed, they were talking about 70% women and 30% men. We see in all our audits about 80% female patients coming for weight management, 20% men. And it's professional men who seek weight management, who fail their medicals, firemen, policemen, all of these types of pilots. We regularly have pilots on the programme. You fail your medical, you can't fly. You fail your medical, you can't be a paramedic and be on duty on the ambulance. So professional people want to come for a professional service in a pharmacy. And the men are key professional people who come in to a pharmacy for that service. So you're missing a big trick if you're not offering any weight management at all in the pharmacy. And again, if they're coming in and they've got weight problems and they're most likely on a lot of prescription drugs as well, you've got a good opportunity for your medicine use reviews as well. Now, talking about the overweight patients, these are just some results from an audit of our programme looking at BMI 25 to 30 patients. Now, you want to be targeting those patients who are overweight. We want health promotion, obesity prevention on the high street. You don't need to wait until people are obese and they've got medical problems. We need to head it off. So with our hat on as health promotion, we can get people to lose weight much easily, a small amount of weight over a short period of time, and then wait until it's a massive problem. So these are from audit results from different pharmacies. Now, Brendan Feeney's group is quite a lot of independent pharmacies who joined together to do an audit, and between them they've seen over 1,800 patients in the BMI 25 to 30 bracket. Gareth Evans, an independent pharmacist on his own, seen 80 patients in that group. Finn McCall, who runs our weight management programme, he's seen 154 patients in this category, and Murray Pharmacy has seen 39. You need to look at people who've got a small amount of weight to lose. It's still important that they don't become obese, they don't develop type 2 diabetes. Again, it's interesting to note as well in pharmacy that bigger patients will come to pharmacy, not afraid to come forward and seek help in pharmacy. So patients with a BMI over 40, and again in the Feeney group of pharmacies, they've seen over 1,980 patients over BMI 40, and they've lost more than 5% of their initial weight. And half of those patients who were over BMI 43, we have patients as big as BMI 50, 60, 70 come to pharmacy because they don't want to see the GP. They feel much more secure seeing another healthcare professional locally, and that they feel they'll get more empathy from and some attention. So we see a lot of big people go to pharmacy, which is important for you to realise about the scales as well. Half of these patients who are BMI 40 plus lost over 10% of their initial weight. 10% on a big person is a lot of weight.
What does that produce in terms of skin folds and sort of surgical necessity?
Now, it's interesting you bring that up because when you use nutrient complete formulas and ketogenic diets, then the body actually looks after itself. You will reabsorb a lot of the excess skin when you diet if you have all the nutrients. So if someone does a normal diet but they're not paying attention to their nutrients and they lose a lot of weight, you often have a lot more excess skin. Now, some people who are older and been big for a long time, they will have some excess skin. But we can say we've had very few people have to go for surgery after having lost it with a nutrient complete formula. So when you're dealing with bigger people, you need to understand about nutrition as well. It's not just about go away and eat less. Eat less of what? If you just cut big food groups out, where's the nutrition coming down from? So you, as pharmacists, you need to be aware of that. And when people have got a lot of weight to lose, they've got to take a long time to be losing that weight. They need to be well nourished. So that's important. And if you are well nourished, you'd be surprised what a good result the body achieves. It's like servicing your car. If you look after it, everything, wear and tear, everything's much better. If you don't bother with it, then you end up with a wreck. And it's literally the same with the body. So well nourished, you will get good results. Learn as much as possible about the problem. That's a good point. There's all these other things. On our website, we have a resource page. There's lots of papers on there, publications. We speak at the Gov Today meetings. We advertise in the GP press. We tell the GPs that pharmacies are offering weight management services. So there's lots of information there. Read as much as possible. Understand BMI. Understand it's not just about getting thin. Lots of customers will come into the pharmacy to lose weight because they're worried about disease problems, want their blood pressure to be lowered. I'm borderline diabetic. I don't want to start medication. Lose weight. So the benefits of substantial weight loss would be reduction in hypertension, keeping diabetes in remission, improving mobility. People don't come in and say they want to be thin. If your knees don't hurt so much, you don't have so much back pain, you can be more mobile, you can enjoy your life more. A big group of patients who come to pharmacy are pre-op patients. hip replacement, knee replacement. They're coming in so they can get surgical procedures done. They need to lose 3 stone to get their hip replacement. So big group of patients in pharmacy are the surgical ones. And GPs will send them in. They don't want Mrs Jones coming every week, waiting for his surgery in pain. They want someone to come along, take that patient away and do some weight management with them. All GPs used to run weight management clinics in the past because they were paid to do so in the old days of the health authorities. The second that money was stopped, they stopped them overnight. So unless they get money for a service, but you can run services that generate money for themselves and that pay for themselves without waiting for commissioning or anything like that. And another big group who come into pharmacy are all the polycystic ovary ladies, all the people with fertility problems, all related to weight. People waiting to go on IVF programs, come into pharmacy to lose weight, get down to a BMI, go off for IVF. So there's a big group of women come in for pharmacy for fertility issues. Now, the Lipotrim Weight Management Programme, it's been running now in pharmacies, I say, for over 13 years. We provide full training for the programme. We have training DVDs, we provide all the materials. There's no cost for these. Scales that weigh up to 32 stone, height measures, all the paperwork you need for the training staff. We have a free phone helpline for the pharmacies to ring on. We have the website with all the resources. We do a monthly newsletter, and I'm going to share some of the tips from the newsletters from the pharmacists today. We have all the patient materials, weight cards, DVD for them to watch, things online for them to use. And they can ring the helpline as well. So if you get bogged down with a difficult patient asking lots of questions, you say ring Val on the free phone line and I'll help them out and get that sorted out for you. We also offer £1,000 value in initial free stock. Now the reason we offer this to pharmacies is it's to reward you for the time you spend learning the programme. We do in-house training, we come to the pharmacy to do it. You can do distance learning, we have all the materials online, but you do need to read it. You do need to understand it. Finn was saying this morning, knowledge is key. If a patient comes in and thinks you understand the problem and you've got a good service to offer, they're going to sign up for it. And the information is there, but we're choosing not to read it. Everybody's busy in pharmacy. You've got to make a decision what you're best going to use your time with to generate income and good health for your patients as well. You also have, using our programme, access to a secure web-based data collection and record keeping aid, which is where all these audit results have come from. And each pharmacy has a unique code to go in there, so when the patients come in, you'll enter all their weight and their details on there. You can produce an audit which you can show to GPs, use as posters. I'll show you a demo one that's a bit later on, there's a slide. And again, full training for that. We're using a webinar and it's not difficult. So take technology on board, so don't get too worried about not being able to do this. This is a typical weight loss profile for a compliant patient using Lipotrim. Now this says a lot of things. This particular patient has lost 6 stone from around 110 kilos down to 70, or about 40 kilos, around 6 stone, in a period of 6 months. So this tells me this is a woman patient, because on average women lose a stone a month on our programme, men lose a stone and a half. Men lose their weight quicker, it's genetic, they've got high muscle mass. But it also tells me for the pharmacy that this patient has come in every week to be weighed for 6 months. And I've helped that patient lose weight and make a life change for them to get 6 stone off. They've also paid me every week for that pharmacy service. They've paid me for their diet product. I've helped them through the refeed stage and get them established back onto food. And they're still coming in to see me after 2 years. So I've built a rapport and a loyal customer. And every time a customer comes in every week to be weighed, they are not going to leave your pharmacy empty-handed. And I know it's cheaper to go to Tesco and places like that to buy toothpaste and bits and pieces. But I've come in for my weigh-in. While I'm here, I'll pick something up. You've got a promotion, you've got something else in store, I'll pick it up. So this weight loss chart is telling you a great deal. Now this is an interesting slide. These are different pharmacies who are running a weight management programme, and these are their Lipotrim sales over different periods of time. So I'm going to break these down for you. And as you can see, there's someone way down earning £2,000 income from their Lipotrim programme, and several up here earning over £1 million. The more you put into a service, the more you get out of it. So, and weight management, these pharmacies are earning even more from weight management because they're not just doing Lipotrim, our product, it's a choice for the patients. So other people are coming in buying over-the-counter products, they're being weighed in the pharmacy, they're accessing other services because you have a weight service. It makes them aware that you've got other services as well. So they're generating massive income from having one good service on board. Now, breaking it down to these two particular pharmacies, the first one is in a population of over 50,000 and in a 10-year period has generated over £72,000 from their Lipotrim income, as opposed to another one that's in a very small population, less than 12,000, but they went to their GP surgeries and said, we are offering a weight management service, we are professional, we are recording all the information, this is what we're going to be doing, we want you to send us your pre-op patients, anybody who asks about weight, just say to them, signpost them to the pharmacy, you know we're offering a weight service. We're going to weigh them and we're going to follow them long term. And in that same 10-year period, that small pharmacy has generated over £400,000 worth of income. They were both trained by me and had exactly the same access to exactly the same materials. And that's the difference. And that's the point. The more you put into it, the more you get out. Again, picking two more pharmacies. One here, around £2,000 income. This one is in a large town. He's a really lovely pharmacist, I know him really well, but he does nothing to promote the service. He doesn't even have the poster in the pharmacy. He doesn't have the patient leaflets, which we provide free of charge for the customer to pick up. They're not in his pharmacy, and he doesn't take any advantage of all that population he's sitting on. As opposed to one that started last year in a small village. He actually only has 2,500 people in the population in his village. But he went to the next town and put information in all the parish leaflets and newsletters, which is cheap, £10. Parish, the sheets that come through your door in local villages and areas, the only thing that keeps them going is the £10 adverts. You put a £10 pharmacy advert in there, weight management, Fred Blogg's pharmacy, come in and see us, ring us, whatever. And in a year, in a small village, he's generated nearly £35,000 of income from Lipotrim. And he was just putting cheap, simple adverts, come to my pharmacy. So make use of what's out there to draw people in. Now, this is an interesting one. We have pharmacists who've been running the programme where she works, but what she's done is she set up a separate clinic in a health centre on a Saturday. Lots of people work and find it difficult to get in for some of the services, and she's hired a room in a health centre, and she, in her own right, so not for her pharmacy, in her own right as a pharmacist, in professional premises, you can be supported to offer a weight clinic. And in 6 years, she's generated £235,000 in income for running weight management on a Saturday. And we also have locums who do roving clinics for pharmacists. So if you feel you can't offer the service or a weight management service yourself, you can use other locums who are trained to run it to use your consultation room. So you have an agreement with them and they come in on Monday and do a weight management service in your pharmacy. You can share the money, you set up an agreement with yourselves, they bring the scales, they bring the service in. So some pharmacies have 2 consultation rooms, but they're not running both of them, or they haven't made use of them, or they don't have other things going. So think about, if you can't fill up the time in your consultation room, offer it to someone else. Because other pharmacies will come in and do a service for you. And we have GPs in the London area who've let pharmacists come in to do a weight management programme, especially in Asian areas where there's such a lot of ill health and problems there. We've got an Asian group of GPs who have let an Asian pharmacist come in and not charge them anything at all for the room in the practice. It's the education room in the health centre, and he runs a weight management clinic there. And because it does help, he speaks several languages to help people through weight management. But it's something that can happen. If you ask GPs, you'll be quite surprised that they'll come on board to do it. But this is fascinating when you look. I trained all of these pharmacists and they have exactly the same materials. So they've made use of it. Another pharmacist has used online freelance web sites where you can go to very cheaply and get adverts and posters and things made up. So you can put information on your website. So if you've got a pharmacy website, Facebook page, anything like that. You can easily get posters made up. Use these in your pharmacy and as for leaflets. Also make use of local gyms. Half the people in gyms are overweight. Put a poster up to say about your services. You know, a bit overweight professional man, go to the gym, slightly high blood pressure. You do blood pressure monitoring. You do weight management. Offer the gym that you'll put their leaflets about the gym sessions in your pharmacy. Link everything you do to what else is going on in the community. Put big BMI charts up in the window. Regularly change your window. Weight management never goes away. It's all year round. And linked to health problems all year round, you need to be doing that. Tips for the most successful pharmacists promoting weight services. Best advertising is word of mouth from successful dieters. Put the effort in. 1 or 2 dieters doing well, losing weight will go away and tell their family, their friends, where they work. We've had an instance where a pharmacist had got a girl to lose lots of weight, 3 or 4 stone. She worked in the local GPO telecom systems office. He closed at lunchtime specifically for all the girls to come from the office to come in for a weigh-in. 15 new customers from the telecoms office because she'd lost weight. Adverts on delivery vans. Say what your services are. If your van's driving round delivering prescriptions, it should say what services you offer as well. Parish council magazines, community newsletters. That village pharmacy made use of that, £10 a go. Testimonials on pharmacy websites, Facebook. Promote along the other services. Get in touch with the services. Text people. People are using text nowadays, so use that and use the posters and the leaflets. We have the tracker program, which is a secure data collecting program, which I told you about. It allows the pharmacist to document everything on the program. I'm going to show you, this is an audit, and that's the poster downstairs in the main room you can see. This is Brendan Feeney's group. Over 13,000 patients lost more than 5% of their initial weight, and 5% being internationally recognised threshold for the benefit of medical benefit. And over 6,000 patients lost more than 9% of their weight. 975 patients lost more than 20% of their weight, with over 488 losing more than 24% of their initial weight. These are fantastic results. The more pharmacies can document your services and collectively join together and present these. We present these data to the Gov Today meetings, to the commissioners, to say this is what pharmacy is achieving on the high street. So collectively we do need to get together and show that we can do this. And again, hypertension, this particular audit, there's screening forms that are done for the programme. So in this audit, over 1,200 patients had hypertension, and of which we expect about 250 would probably have their medication stopped. I mean, now on the tracker programme we can document whether people have stopped medication or not. So that's a new little thing that we've put in. Before we just knew they were on it or off, but now we've just fine-tuned it. And diabetic patients, again, 90 patients were seen through pharmacy. Type 2 diabetics on medication had their medication stopped. And in fact, it has to be stopped when you start a strict programme, because you're not putting the sugar in the top. If you use a formula, a nutrient complete formula, like an enteral feed, you're not needing any of that diabetic medication. You're not putting a sugar load in the top, and blood sugar actually falls to normal within the first few days.
Sorry, can I ask a question on that? I mean, how does that work then if a patient is type 2 diabetic, is on a range of medications and things, and they present, say, to somebody that offers this program saying, I'd like to start, what happens? Are they referred back to their GP?
Yes, yeah, you will need to be in conjunction with the GPs. Now, we advertise in the GP magazine regularly to say this programme exists in pharmacy, and that pharmacists need the cooperation of the GPs for diabetes. So we constantly target diabetes and linking it for the GPs and to the pharmacies to do it. Some GPs are very helpful, others aren't helpful. I mean, sometimes you know in your own area, if you've got a miserable lot of GPs, you won't do anything. But we get very good results now. And the longer it's gone on and the more data we put out there, the more the GPs are valuing pharmacy getting these results. Now this actually is an audit result from an actual pharmacy, New Park Pharmacy. Now this is their audit, so this is one of their patients, their weight loss, and he's produced this as an A4 sheet to give to all his local GPs, and he has it as a poster in the window, and we've produced a pop-up stand for him, like the stand downstairs. So we've produced that for him, and he has that in the pharmacy. So that makes customers look at that and come and ask us about losing weight. So simple things like that, your results in your community, and let your patients see it. Again, I mean, talking about weight loss, you need to keep weight off. It's one of the key things people ask about. It's all very well losing weight. Weight management is not about a diet, it's about the long term. It's about what you do. And actually, VLCD dieters lose considerably more weight than people on normal hypercaloric balanced dieters. And at 5 years, in this meta-audit of 29 studies, more VLCD dieters have sustained more weight loss over the time period, greater than the actual total loss in the hypercaloric group in the first place. So even though people think, oh, it's a difficult way to diet, it gives the results, it gives the medical results, and it makes a big difference. These are some key things that pharmacies have said. I think you can probably read it from there. Although we had the initial training, we also learn a lot as we go along when we come across an unusual query with a customer. We call Val Beeson, such as me, for an answer, and we make note of these in our notebook. Having knowledge of all our diet products and how and when Lipotrim fits in within a weight management service helps us give customers a good service. Not everybody's going to choose Lipotrim, a strict total food replacement. They might want to have an over-the-counter product, they might want to do healthy eating, but you're still going to offer all the advice, you're still going to weigh them. And often they start on one programme and then move on to another. So it's about management. It's not the actual diet per se, it's offering the service. Having the rapport with the customers, again type 2 diabetes is mentioned here, educate customers about reviewing lifestyle long term. Click on to another one here. This is in Medicine Centre in West Glamorgan. We also work with community leaders and do local health shows. We have lots of pharmacies who do an open day in the pharmacy and say what your services are. This is our consultation room. You can come and see us privately and ask us things. You can have an open afternoon. Fill your window with balloons. You don't have to spend a massive amount of money. Why is that window full of balloons? We're going to have a look at it. Simple. Doesn't cost you a lot. Load of leaflets out there. Introduce the staff. Here's our consultation room. This is what we offer. Hasn't really cost you a lot. So those sort of things. And this pharmacy is very good at doing these services and getting in with community groups. So, you know, going to the elderly groups or WI, all sorts of things. So it's important to do that. Oh, which back to this one. Gareth Evans here again. Gareth's a young pharmacist, very keen on Facebook and texting everybody, and he sees a lot of people, and he uses the tracker program. Now, the tracker program is good for putting data on, but it also shows you weight loss graphs to show the patients, and when they've lost weight, they can actually calculate how many calories they need to use to keep their weight off. There's a patient interface that they can use. Lots of people do that. The young people do it. So we need to embrace that. It's not the old fusty routine paper stuff. I mean, it's hard sometimes to think we've got to get all computerised, and I'm the world's worst for paper. But we do need to just see that customers do like to do that. And so that's important as well, that we're doing that. Just whizzing through these quickly. And the main point we've got to take on board today is to make a change. We have got to change to move pharmacy forward. So again, for patients, sort of the long term, keeping their weight off and what they're going to be doing. And I've just whizzed through another note. You really got to help people understand what is going on and what needs to be changed. Because people are saying things like, I don't eat a lot. You have to explain. You might not think you're eating a lot, but you're eating more than you need. So we're not accusing people of eating chocolate and chips all the time. You have to get ways of saying it. People say, I don't eat butter, I don't eat cakes, I don't eat biscuits. You don't need to. Practically everything, all drink, all food is 99% full of calories. It's the portion sizes. So you need to learn about portions and understanding that. Everything comes in big packages nowadays, comes in big portions. Everybody's overeating, which is why more than half the population is overweight. And we need to think, I always say to people, think of an elephant. It doesn't eat cheese, it doesn't eat chips. It only eats vegetation, but it eats for 20 hours a day. So it's a change that we need to think about. And we'll be on the stand downstairs. You can ask us lots of questions, and we'll be having the group discussion later on at the end of all the workshops. So if there's any things you want to bring up about what we've talked about today, we'll go through it then. We'll better wind it up.